I'm Associate Professor Julian Rait. I'm the President of AMA Victoria.
And Dr. Simon Judkins, I'm the President of the Australasian College for Emergency Medicine.
Thanks very much. Now, what are your takeaways from that? That was quite an extraordinary panel discussion, really, on a day that's very timely. Simon?
Oh, look, I think the takeaway for me is that colleges and doctors need to do a lot more in the space of advocacy around mental health, advocacy around refugee health, but also vulnerable populations generally. But clearly, there are patients still on Nauru and on Manus who are suffering, and the strong message from the presenters, the panelists, is that medical bodies, colleges, doctors need to be vocal, need to advocate. We're still listened to, we still are a trusted source, and we need to use our positions to really strongly advocate to get a change.
How involved has ASEM, the Australasian College for Emergency Medicine, how involved has it been in particularly around Nauru and Manus?
I think we've had some social media campaigns, but I think there is a hell of a lot more that we actually do. And we're actually having some discussions at the moment about what we can do further, particularly in the Manus Island situation. But we can't talk too much about that. But there is certainly a lot more I think that the colleges can do, and I think there's a lot more that ASEM, our college, can actually do.
When will you be able to talk about those things?
Not sure.
Okay, can watch this space. Okay, Julian, if you could talk about your takeaways
Sure.
from this and what the AMA in Victoria has been doing as well as nationally.
Well, I guess I can speak on behalf of both the state and the federal organisation, because I'm a federal councillor as well and been party to the discussions with government, and also party to the advocacy the AMA has been conducting over the last few years concerning this issue. I think the takeaway for me is that we've actually reached a tipping point. Finally, we've got sufficient critical mass of medical practitioners and other groups agitating for change, and we've all come to the conclusion that obviously the continuing institutional cruelty that's being perpetrated on both Nauru and Manus has to end. In the first sort of case, we've been concerned particularly about children that were there, and we've now reduced the number of children down from around 60 or 70 down to around, I believe, 10 or 12 is remaining on Nauru. But that doesn't mean to say that we don't obviously want the remaining children removed, and in the longer term obviously we want to see offshore detention ending at both Nauru and in Manus. The great message I think we have today is that there's going to be continued agitation by the medical profession through the colleges as represented by Simon, through ourselves representing the medical profession more generally, but also through other health groups, nurses, midwives, and also concerned citizens who believe that this policy is deeply flawed.
Now, we talked in the panel discussion around the ethical, political, other barriers and opportunities, and the AMA has straddled some interesting ground on that. Certainly it stepped back federally under your previous president and has now shifted again. Can you, what drives that?
I've reflected on that. I think that that's really us trying to find the best way forward. That under Brian Owler, who really sort of pursued this vigorously, he would bring it up on every occasion he met with any federal minister. The trouble was that then sort of like started to marginalise us, so that whether they would meet with us and so on, so that the alternative view taken by Michael Gannon subsequently was mainly I'll try sort of engagement and trying to work behind the scenes with the Department of Immigration and Border Protection to try and see if we could get individually people out. But really under the current president, under Tony, he's gone further and he's realised that really the situation hasn't really been changed by either of those two approaches. So hence there's been a much more, as it were, vocal and more direct attack on the policy which has occurred in recent times. So, on the one hand you can sort of like look at those things and say, well, perhaps we'd step back a bit or we'd step forward too much. But really we were trying to find a policy that would work, and really we were frustrated in the lives of the two previous presidents getting anywhere. Now I think we've actually got a much stronger voice because we've got really the whole of medicine and through the colleges and other associations talking with us at the same time.
So how did that happen? Why did that happen?
Well, I think the reason that happened was because particularly, well, you heard today from Louise Newman at this meeting. Now, I think it was her advocacy in particular, and I think others who were caring for traumatised and damaged people on Nauru, particularly the children, who realised that the situation just couldn't continue any longer without there being very significant harm done to these vulnerable people. So there was kind of like a sense of, I suppose, ethical alarm that suddenly has been ringing in our heads, saying, well, you know, we can't just sit by and we have to really sort of take very dramatic action to change things.
So I think the combined voice, I think that's the point. It was made very clearly by the panel that is that the colleges need to also represent. There's some amazing clinicians out there doing work. There's midwives and there's doctors who've been doing work to support, to care for the refugees, and they've been cast aside as well, and they get burnt out and stressed as well because it's incredibly draining for them. So colleges, we need to support the workers, the people who are doing the work, but also I think the collaboration between medical authorities, medical voices, colleges, the AMA can actually send a really, really strong message. And I think, you know, as Julian said, we have a moral and ethical responsibility to actually do that.
That was a very interesting discussion about the role of whistleblowers, really, and it was caught up in that thing of should doctors work in detention centres, or certainly in places like Nauru and Manus, should they ethically do that? And George Newhouse, the lawyer here, he said particularly that they, in court cases, they have relied upon that. But there is that need for colleges to stand up and support them. What can colleges do?
Well, I think that's where the colleges can support the clinicians doing that work, because it is very difficult for clinicians, individuals, to stand up and fight that fight and be the whistleblower. So I think we need to give them that institutional support, and we need to be actually advocating and being the voice for their concerns. And it's not only around the refugee policy, there's lots of things that we can do better to be voices for individual clinicians. You actually, I'll jump in on that one because you gave a shout out to all the kids out striking today for the climate. Well, I think that was the other point we're trying to make, is that, you know, we have an ethical, you know, moral responsibility for all of our patients, but we also have a responsibility for our children. And it was interesting when we were having this conversation that, again, I was looking on Croaky and saw all of our kids are advocating for climate change as well. So we have a responsibility to set an example for them and get this right.
Okay, so we've got a federal election coming up. We've got Dr. Karen Phelps having introduced the legislation to bring people from Nauru to Australia. What should medical professionals be out there doing right now?
Well, I think we need to look at the legislation, but it was a very good example given about how medical professionals can work with their local MPs, their local representatives, and they can go and meet them and they can advocate for the position with their local representatives, because all that feeds back up into and puts pressure on our parliamentarians to make a difference.
Look, I can disclose that the AMA has seen the draft bill, and while I'm sure that the medical profession would support it, I think the key question is here whether the ALP will support it, because clearly, for it to succeed, it not only needs crossbench support, it needs the substantial number of politicians from each side, hopefully, supporting this as an important gesture in terms of human rights and the health of asylum seekers. So I think that while we would all support the intent of this bill, I think that we're some way away from actually having it supported by sufficient numbers of politicians to make it law. So I think the next week or two, it's going to be very clear. We're going to have to step up our advocacy and make sure that people understand that something along the lines of the proposed bill is what's expected.
Thank you both very much.